as blood pools in the veins after death. It was subsequently assumed they were filled with air and served to transport air around the body. Philosophers distinguished veins from arteries, but thought the pulse was a property of arteries. Erasistrato observed that arteries cut during life bleed. He ascribed the fact to the phenomenon that air escaping from an artery is replaced with blood which entered by very small vessels between veins and arteries. Thus he apparently postulated capillaries, but with reversed flow of blood. The Greek physician Galen, 2nd century AD, knew blood vessels carried blood and identified venous, dark red, and arterial, brighter and thinner, blood, each with distinct and separate functions. Growth and energy were derived from venous blood created in the liver from chyle, while arterial blood gave vitality by containing pneuma, air, and originated in the heart. Blood flowed from both creating organs to all parts of the body, where it was consumed and there was no return of blood to the heart or liver. The heart did not pump blood around, the heart's motion sucked blood in during diastole and the blood moved by the pulsation of the arteries themselves. Galen believed the arterial blood was created by venous blood passing from the left ventricle to the right through pores in the interventricular septum, while air passed from the lungs via the pulmonary artery to the left side of the heart. As the arterial blood was created, sooty vapors were created and passed to the lungs, also via the pulmonary artery, to be exhaled. Pre-modern, the earliest descriptions of the coronary and pulmonary circulation systems can be found in the Commentary on Anatomy in Avicenna's Canon, published in 1242 by Ibn al-Nafis. 45. In his manuscript, al-Nafis wrote that blood passes through the pulmonary circulation instead of moving from the right to the left ventricle, as previously believed by Galen. 46. His work was later translated into Latin by Andrea Alpago. 47. In Europe, the teachings of Galen continued to dominate the academic community and his doctrines were adopted as the official canon of the Church. Andreas Vesalius questioned some of Galen's beliefs of the heart and De Humani Corporis Fabrica, 1543, but his magnum opus was interpreted as a challenge to the authorities and he was subjected to a number of attacks. 48. Michael Servetus wrote in Christianismi Restitutio, 1553, that blood flows from one side of the heart to the other via the lungs, but his book was considered heresy and he was condemned and burned at the stake in Geneva. 48. The breakthrough came with the publication of the Mota Cordis, 1628, by the English physician William Harvey. Harvey's book completely describes the systemic circulation and the mechanical force of the heart, leading to an overhaul of the Galenic doctrines. 49. Modern Otto Frank, 1865-1944, was a German physiologist. Among his many published works are detailed studies of this important heart relationship. Ernest Starling, 1866-1927, was an important English physiologist who also studied the heart. Although they worked largely independently, their combined efforts and similar conclusions have been recognized in the name, Frank Starling mechanism. 7. Although Purkinje fibers and the bundle of his were discovered as early as the 19th century, their specific role in the electrical conduction system of the heart remained unknown until Sonau Tyra published his monograph, titled Das Reizleitungssystem des Sagtierherzens, in 1906. Tyra's discovery of the atrioventricular node prompted Arthur Keith and Martin Flack to look for similar structures in the heart, leading to their discovery of the sinoatrial node several months later. These structures form the anatomical basis of the electrocardiogram, whose inventor, Willem A. Einthoven, was awarded the Nobel Prize in Medicine or Physiology in 1924. 50. The first successful heart transplantation was performed in 1967 by the South African surgeon Christian Barnard at Groote Hospital in Cape Town. This marked an important milestone in cardiac surgery, capturing the attention of both the medical profession and the world at large. However, long-term survival rates of patients were initially very low. Louis Washkinsky, the first recipient of a donated heart, died 18 days after the operation, while other patients did not survive for more than a few weeks. 51. The American surgeon Norman Shumway has been credited for his efforts to improve transplantation techniques, along with pioneers Richard Lower, Vladimir Dimitrov, and Adrian Kantorowicz. As of March 2000, more than 55,000 heart transplantations have been performed worldwide. 52. By the middle of the 20th century, heart disease had surpassed infectious disease as the leading cause of death in the United States, and it is currently the leading cause of deaths worldwide. Since 1948, the ongoing Framingham Heart Study has shed light on the effects of various influences on the heart, including diet, exercise, and common medications such as aspirin. Although the introduction of ACE inhibitors and beta blockers has improved the management of chronic heart failure, the disease continues to be an enormous medical and societal burden, with 30 to 40% of patients dying within a year of receiving the diagnosis. 53. Society and culture. Further information: Sacred Heart, heart symbol and blood paragraph. Cultural and religious beliefs. JB, F34, heart in hieroglyph symbolism. Letter of the Georgian script is often used as a heart symbol. The seal script glyph for heart, Middle Chinese sim, as one of the vital organs. The heart was long identified as the center of the entire body, the seat of life, or emotion, or reason, wu, intellect, purpose, or the mind. Thus, in the Hebrew Bible, the word for heart, lubab, is used in these meanings, paralleling the use of diaphragm in Homeric Greek. An important part of the concept of the soul in ancient Egyptian religion was thought to be the heart, or ib. The or metaphysical heart was believed to be formed from one drop of blood from the child's mother.